Hey, welcome to The Explainer. Today we're tackling a topic that, let's be honest, almost all of us will deal with at some point: lower back pain. And it's so much more than just a minor annoyance, right? It can be this persistent, frustrating thing that really gets in the way of life. So, let's break down what's actually going on.
Think about it. That dull throb you get after sitting at a desk all day, or that sharp, surprising twinge when you lift a box the wrong way. If you're nodding along right now, you get it. It's a super common and super unwelcome part of the human experience.
And when I say common, that's almost an understatement. So if this is you, you are definitely not alone. Having back pain isn't some kind of weakness, and it's for sure not something you just have to tough out. It's one of the most widespread health issues on the planet. And the scale of this is, well, it's massive. A 2020 study called it the #1 reason people miss work and the leading cause of disability across the entire globe. So this isn't just about feeling a little sore. It has a huge impact on people's lives and even whole economies.
So when does this whole journey with back pain usually kick off? Well, it can happen at any time, but that first big episode often hits between the ages of 30 and 50. And that's not just a coincidence. It's partly just the body's natural aging process. You know, the little cushions between our vertebrae, our discs, they start to lose a bit of fluid. And we can lose muscle tone, which leaves our back a little more open to getting strained.
Okay, so to really get a handle on this, we've got to understand the why behind it all. The causes can range from something super simple like a muscle strain to more complex long-term conditions.
All right, let's look at the usual suspects. You've got your everyday muscle strains from, say, a weird twist or lifting something heavy. That's super common. But sometimes the issue goes a little deeper, into the structure of the spine itself. We're talking things like herniated disc or sciatica. Let's actually zoom in on those two, because they're really key.
Okay, so what in the world is a herniated disc? The absolute best way to picture it is to think of a jelly donut. Seriously, your spinal discs have a tough outside and a soft, jelly-like middle. If that tough outer part gets a tear, that soft jelly inside can squeeze out. And when it squeezes out, it can press on all the sensitive nerves right next to it. That pressure is what you feel as pain.
Now let's connect that right back to our jelly donut. When that leaking jelly pushes on one very specific, very long nerve, the sciatic nerve, which runs all the way from your lower back down your leg, you get what's called sciatica. And that's exactly why the pain isn't just in your back. It travels, it radiates. It's that burning, tingling, pins and needles feeling that can go all the way to your foot.
Now, a really important distinction here is the timeline. We talk about acute pain, which is that sudden, intense flare-up that usually gets better on its own in a few days or weeks. But if that pain sticks around for more than 3 months, well, it gets a new name: chronic pain. And that often needs a whole different game plan.
So if the pain just isn't quitting, it's probably time to see a doctor. But what does that even look like? Let's demystify that process a bit. It's not some big mystery. It's actually a pretty clear, structured path to figuring things out.
The whole journey usually starts pretty simply, with a conversation. Your doctor will want to know your history, what the pain feels like, what makes it better or worse. Then comes a physical exam, where they'll check your movement, your reflexes. And it's good to know that imaging tests, like X-rays or MRIs, aren't always the first step. They're usually only brought in if there's a reason to suspect something specific. But if your doctor decides they do need a closer look, these are the tools they've got. X-rays are fantastic for checking out the bones themselves, but an MRI, that gives an amazing, detailed picture of all the soft stuff, like those spinal discs we just talked about and the nerves around them. Okay, everybody, listen up, because this part is incredibly important. Most back pain is not a true emergency. But, and this is a big but, there are a few major red flags. If your back pain comes with weakness in your legs, a fever, or, and this is critical, any loss of bowel or bladder control, that is your sign to get medical help right away. All right, so understanding the cause is half the battle. But now we get to the part everyone really wants to know. How do you get relief? The great news is, there's a whole toolkit of treatments out there. So let's explore that path to feeling better. So the treatment options really exist on a spectrum. A lot of the time, you can manage things really effectively right at home with simple stuff like heat, ice, or over-the-counter relievers. But for that more stubborn pain, there are medical treatments like physical therapy or targeted injections that can really help reduce inflammation and get you moving properly again. And here's a pro tip: timing is everything. For that sudden, acute pain, what you do in those first 72 hours can make a massive difference.
Acting quickly with that at-home care can help calm everything down and might just stop a small problem from turning into a big one.
Okay, so what about surgery? It's really important to think of this as the top of the pyramid. It's a last resort. It's usually only considered for really severe cases, maybe where there's nerve damage, and only after all the other treatments haven't worked. A procedure like a discectomy, for instance, is designed to go in and physically remove that little piece of jelly that's pushing on the nerve.
Now, treating pain is crucial, but you know what's even better? Not getting it in the first place. So the best offense is a good defense. Let's talk about proactive care and how you can build a stronger, more resilient back for the long haul.
Honestly, prevention boils down to a few key habits. Strengthening your core, your abs and back muscles is huge. So is maintaining a healthy weight. Using good form when you lift things, lift with your legs, not your back. And here's one that might surprise you. Quit smoking. It turns out nicotine actually damages your spinal discs, making them weaker and less able to heal. Crazy, right?
So here's a simple, super effective exercise you can try. It's called the Superman. You just lie on your stomach and gently lift your arms and legs, really focusing on squeezing the muscles in your lower back and your glutes. The key here is slow and controlled movement, not how high you can lift. Hold it for just a couple of seconds and then lower back down. It's a fantastic way to build up that core support for your spine.
And of course, strength needs to be balanced out with flexibility. The knee to chest stretch is just perfect for that. As you lie on your back and gently pull one knee in, you're releasing a lot of that built-up tension in your lower back and glute muscles, two spots that can get incredibly tight and really contribute to pain.
So if you take away just one thing from all this, let it be this. You don't need to go out and become some elite athlete. It's the small, consistent things you do every single day. A few minutes of stretching, a little bit of strengthening that compound over time and make all the difference for your back health.
So, I'll leave you with this question to chew on. It doesn't have to be some massive life change. Maybe it's just deciding to do a 2-minute stretch. Maybe it's adjusting the ergonomics of your chair at work. Maybe it's just getting up for a short walk. What is that one small, totally achievable thing you're going to do today for your back? Thanks for joining us.